I'm Dr. Bana Kashani, and I'm part of Eden Centers for Advanced Fertility. It's exciting to be part of this new center that has state-of-the-art comprehensive fertility services for all patients and couples. And I am passionate about taking care of patients from couples who have infertility, recurrent pregnancy loss, and of course the LGBT community. So where did all this start? I had always been passionate about medicine. Somehow or another, I was the only person in my family who desired to develop this passion as a child. I would watch anything on Discovery Health related to medicine, surgeries, and it really pushed me to pursue a degree in biological sciences at the University of California, Irvine. From there, I attended medical school at the University of South Alabama. And after that, I knew that I had a desire to pursue a field in women's health. There was a passion for me related to pregnancy, related to couples who have trouble getting pregnant, and as well as gynecologic care and surgery. I've always had a passion for surgery as well. So I was lucky to find an excellent training program at the University of Southern California in Los Angeles, where I worked for 4 long years at the county hospital, and I developed tremendous experience taking care of a lot of women who otherwise weren't able to receive appropriate medical care. During this time, I knew that I wanted to proceed with a career in fertility. I loved everything related to reproductive health and endocrinology, and I was fortunate to have some amazing mentors there and get involved with some extensive research related to infertility. So I was lucky to transition into a very competitive specialty of reproductive endocrinology and infertility at Rutgers, New Jersey Medical School. And during that time, I was involved in a lot of extensive basic science research, and I was working on understanding human endometrial cells, implantation of pregnancy, and factors that affect very early pregnancy in the immune system. I was able to complete all ranges of reproductive surgery, particularly focused at fertility surgeries for women in relation to fibroid surgery, also surgeries for women who had uterine adhesions, pelvic adhesions, endometriosis, and basically provide comprehensive care all the way from surgical care for fertility through procedures such as inseminations or IVF. After completing my training, I was able to move back to my lovely hometown of Orange County and practice here for the last several years, initially starting my journey at Kaiser and then now here at Eden. I'm excited to be part of your fertility journey. What makes me so unique is that I truly try to tailor all of my fertility treatments specific to my patients. So what does that mean? I know that not one treatment should be equivalent for every single patient or couple, and not one thing may always work for 2 different people. And so I really try to spend extensive time focusing and listening and understanding what a patient and couple's goals are for their fertility. And this will vary. There are some people who walk into my office who will only desire to try to achieve a pregnancy the most natural way as possible and will not want to proceed with treatments such as in vitro fertilization or IVF. But, my job is to explain to them how we can get there and avoid other alternative assisted reproductive technologies. But I also have to lay a framework of understanding of what their success rate will be with each treatment. Sometimes we start with something that is mild, and if that doesn't work, we can regroup, reassess, and decide on what next steps we want to take. I try my best to take care of all my patients and treat them as if they were my own friend or family member. And I think that is really represented in my, rapport and interactions with patients. I try to make people feel as comfortable as possible because infertility is not something that anyone wants to go through. It is not any couple's plan to be sitting here in my office, and I want to ensure that communication is open and people feel comfortable in making all their decisions. So that's a little bit about myself and a summary about my background, how I became a specialist in fertility, and I hope that I can be part of your fertility journey and help you achieve your pregnancy goals in any way that will be best suited for you.